It's the time of the month that can be quite stressful and painful for many women. Dr. Monty Swarup from New Horizons Women's Care, a branch of Arizona OBGYN affiliates, is here to talk about a procedure that can actually help control those heavy periods. Good morning. It's
good morning.
To see you.
Good to see you too.
Now I have to look at my notes. Endometrial ablation. Am I saying it correctly?
Endometrial ablation. Yes,
okay.
You are.
Talk about what it is. I mean, I think we've seen things about it, but we don't know exactly how it works.
Endometrial ablation is nothing new. We've actually been doing it since the early 90s, but about 8-9 years ago, several instruments came out that made endometrial ablation a lot safer, a lot more popular, and a lot more effective to do. What we're trying to do, and if we could show the diagram that we have here, we're actually trying to remove the pink lining that you see there of the inside of the uterus. The pink lining is the endometrial glands that are overactive in ladies that have problems with heavy or painful menstruation. The device actually will go inside, it opens up, and the treatment time for the actual procedure itself is only about 90 seconds, but the whole process takes me about 5 minutes to do. And what we do afterwards is we're trying to create some scar inside the lining of the uterus, but only create scar from the source of the glands that are overactive. The other beauty of the process is because we're not doing anything outside the uterus, the ovaries are completely untouched. The procedure will not put patients into menopause. Their hormones are exactly like they were before.
Oh, so everything is normal. Menopause, everything it doesn't trigger anything.
That's exactly it. Now, one advantage of menopause is one of the chief symptoms that we see people for during perimenopausal and menopausal times is issues with bleeding. But with this procedure done, their cycles are usually very light or non-existent. In my hands, about 40 to 50% of people actually have 0 cycles afterwards, but they're not in menopause.
Huh. Now, who's a candidate for it then?
Anyone who's completely completed having their family that they'd like to. It's very important that patients have, we believe, a form of permanent birth control in order to have the process done. And we offer many types of permanent birth control that we're happy to talk to you about in the office as well. But basically, the pink lining that we showed in the diagram earlier, it's where pregnancies actually implant and grow. And once you've had your family, there's really no utility or need for that lining.
Okay.
In actuality, the lining itself produces a lot of chemicals and prostaglandins monthly too, and the procedure itself has been shown to be helpful not just for painful periods, because if you don't have that tissue building, you're hopefully not going to have painful cycles as well, because you won't have cycles, hopefully. But also, it's been helpful for PMS.
I was going to ask you, does it help with PMS symptoms?
Very much so. And we're not 100% sure as to how or why it helps with PMS, but my theory is that if you're not building up a lot of those chemicals there monthly, you're less likely to have, all the chemicals circulating.
The crabbiness and everything that goes along with it.
You said that, not me.
That's okay. I'll take credit for that.
Yeah, exactly. But the other side of it, too, is in ladies who have heavy cycles and painful cycles, there's a tremendous emotional toll that almost more commonly than not, I'll see people for referral, and I ask them questions about what they're doing in place, around their cycles, whether it's work, athletics, social events, or even sex.
And they probably stop cold, a lot of those things.
A lot of people do, and I think that they start to realize very quickly when I ask them these things, how they're working around this, and it just doesn't need to be that way whatsoever.
Now, will insurance cover this procedure?
It's very routinely covered through insurance, actually, and we work very hard with insurance, whether it's the state or with the large insurers in our area, to ensure that this is covered, not just in hospital or in outpatient settings, but in office.
Yes, we were looking at some pictures, too, of where you can perform the procedure. And this is in your office, then?
We do. These are some pictures of our office as well. This is the waiting room. We have a big plasma TV on one side, and you can see it runs your show quite often as well. In the middle, there's a cafe, and when you check in, you get a pager like you do at a restaurant. The entire design of the place, this is a picture of a patient room, and again, we have TVs in there for your comfort while you're waiting for us to come in. But the entire design of the place was to make sure that we created a family environment. We knew that we would have pregnant patients come in through as well. We do deliver babies, of course, lots of them. But we also knew that we would have family waiting for patients that were having procedures done as well, and we wanted to make sure that we created a comfortable environment for all things.
And judging by those pictures, you certainly did. Thank you very much. Very good information. Good to see you again, too.
Good to see you.
So if you would want more information, of course, on the NovaSure procedure, it's very easy. You can go to your website at newhorizonswomenscare.com or go to aoafamily.com, or you can call the number that you see right there on your screen.